share it with other people in your coalition or environment and workplace. So yeah, let's get started. So my name is Shay Montemuro. I currently work with TTASC, which is the Connecticut Training and Technical Assistance Service Center. We work to kind of increase the prevention workforce in the state of Connecticut. However, we're not limited to the state of Connecticut. I know we have a lot of people who also attend our trainings from other places. On this call, I am also with Lisa Mason, Jen Jacobson, Ken Plord, David Reyes, and I think Mark Nichols on as well. So we are part of the TTASC team, and we also provide technical assistance to those who work within not only trainings, but technical assistance to those who work within the prevention work field. Okay, next slide. So our learning objectives for today, we're going to cover what exactly is prevention, and go through some key terms as far as what is prevention and how we work within our frame of prevention. We're going to cover the continuum of care, and we'll go into more detail about that. We're going to cover risk and protective factors of prevention, as well as some strategies and theories that we use within our work in the prevention field. Lastly, we're going to go over some drug facts and some knowledge concerning the different drugs and substances that you may encounter as a prevention professional or a certified prevention specialist. Right. So some of these terms, I'm not going to go through every single term, but I'm going to mostly hit on the terms that we use the most, that you're going to encounter the most while we're working through this presentation. Some of these terms I might read verbatim just because if you are preparing yourself for the CPS, which is the Certified Prevention Specialist exam, it is important to know these definitions to the best of your ability, as well as to the best of the definition that has been defined. So first, we want to start with our evidence-based prevention strategies. Those are going to be our strategies that have had a lot of documented research, a lot of documented research demonstrating that they are effective against specific substances and associated risk factors. Risk factors are going to be variables that increase probability of using substances. Protective factors are going to be the variables that decrease the probability of an individual using substances. And then we are also going to cover our strategic prevention framework, which is a 5-step public health planning process where we use data to identify and address local prevention needs. One of the terms that is not on this slide is adult use marijuana. You'll hear me use adult use as opposed to recreational to denote that, like any other substance, use of marijuana is not a necessarily fun thing as a way to reduce stigma among youth and experimenting with this substance. So you'll hear me use adult use as opposed to recreational use. You may also hear me say partner community a lot of times as we work in partnerships with communities and come to understanding of the needs of our communities as we work with them, as opposed to working on what we feel is necessary for the community. We partner with the communities. Moving forward, what is prevention? So prevention is basically a culturally appropriate and evidence-based program. We usually use within our framework the strategic prevention framework, as well as activities that are going to keep communities, partner communities, from stages of substance misuse, disorder, or use. We also use common data sets across service systems, which later on we're going to kind of touch on the 12 sectors a little bit. And we use those to help us assess our prevention efficiency and also to promote accountability within a community and across different service sectors. Touching on more about what prevention is, we work with a wide array of groups in order to reduce the number of people who may experience substance use and misuse. So it is important that our developing workforce is able to understand the traumas that the communities we work with may be experiencing and how this may lead to risk factors of substance use. We want to practice and promote evidence-based programs and resources which are going to be beneficial to our our partner communities, as well as we want to increase positive youth development and the promotion of healthy communities. Just a little bit about the history of prevention in the US. So in the US, we know that we may or may not know that a lot of our prevention efforts against different substance use and abuse began as early documented as the late 1920s to 1930s during Prohibition, which was the prevention of sale and manufacturing of alcoholic beverage. It was done in order to reduce crime, corruption, and other basically unlawful social acts that were deemed immoral by the governance at that time. However, many critics say that Prohibition was a failed act as it didn't really stop people from using different substances. If anything, it caused people to deviate and use substances in a way that was deemed illegal or morally corrupt by making their own substances or illegally using substances. As we go down this list of different stages of our prevention within the United States, I'm going to kind of skip forward to the 1990s, where we began to do more research on focusing on our risk and protective factors and community-based collaborations. This is kind of where you start to see the beginning of our trek to what we have now, as we build more community-based programs to build efforts in prevention. As we get to where we are now, we notice that we have a large epidemic within opioid use, as well as the increased legalization of marijuana within the United States. And now that's also where we have an abundance of information that connects substance use with mental health, as well as looking at the social and psychological evidence-based approaches to prevention as we move forward in our efforts for prevention. Next, it's important that we understand that prevention across the lifespan is an important factor in the work that we do, because it's not only the people who use substances who are affected, but also their children can be affected. And this can be done through pregnancy, with the prevalence of use during pregnancy causing developmental delay, increased risk of SIDS and fetal alcohol syndrome. Children may have a development of respiratory diseases such as asthma, bronchitis due to secondhand smoke, endangerment from their parents due to alcohol or drug use, developmental issues, and cases of domestic issues. As teenagers and young adults, they start moving into the adolescent phase. Their developmental stage is an onset of experimentation within their social circles and a susceptibility to experimenting with different substances. As we move into young adulthood, we notice that there is going to be a transition from the security of their family unit. As young adults, they move into moving away from home, out of the security of their family, moving into more college spaces, military spaces, entering the job force, into basically adulthood. We see progressive forms of substance experimentation, use, or dependence as they move within these spaces where they might not necessarily have the support and security of their family unit back at home. Older adults, as we move into more middle age and elderly populations, may have instances of prescription drug use or misuse. And at this age, people may begin to experience stress from work and family, all of their life responsibilities. If they began use in their earlier adulthood, maybe still suffering from misuse of alcohol, drugs, smoking, and going through treatment for any of these substance abuse problems that they may have had at the beginning. Next, we want to look at what is the strategic prevention framework as we work through what prevention is. So the SPIF, as we call it, strategic prevention framework, it's a public health model that serves as a operating system within the prevention workforce. It's basically what we use in order to organize our coalition work and also affects long-term change in substance use with our partnering communities. So there are 5 steps within this strategic prevention framework. There is assessment. This is where we basically get a profile of the needs of our population, the demographic of our population, what resources they currently have, their readiness, and what we need to do to what gaps need to be filled. Our capacity, we mobilize and build organizational infrastructure. What can we do to address those needs? Planning, this is development of our strategic target. What needs to get done? Implementation, and this is where we go ahead and we execute the things that we planned for in our planning and capacity stages, as well as our assessment. We execute evidence-based prevention programs and activities that are needed within our partnering community. Evaluation, we go back and we monitor, evaluate, and we see what we need to sustain as well as what we need to improve for our programs, or if we need to replace our program altogether. Also within the strategic prevention framework, we have 2 guiding principles, sustainability and cultural competence. So sustainability is the process of building an adaptive and effective system. We want to be able to have a system that, should we lose funding, should we have a change in staff, should there be any changes, we are able to sustain this program and continue to grow and build on this program. Cultural competence, this is the ability for an individual organization to understand and effectively interact with people of different values, lifestyles, or traditions. Cultural competency does not necessarily infer racial or ethnic demographic. However, we have things such as our different value systems, whether the partnering community is going to be rural or urban, or even suburban, socioeconomic status, as well as language differences and the majority religion within that particular area. Next, we have the 12 sectors. The 12 sectors are being able to implement community change. So we have different areas of the different sectors, representatives who can be allies in our work for our coalitions. So we have a total of 12 sectors. They are parents, business, media, schools, youth serving organization, law enforcement, civic organizations, faith groups, healthcare, government organizations, substance and youth organizations. Basically, these are organizations that are able to help us and have representatives from our different sectors in order to bridge any gaps within the sectors so that we are able to have a cohesive community in working towards substance prevention. So everything, our substance and our prevention work, it works better when we're all in this together. So we need all of our 12 sectors. We need our planning of the strategic prevention framework and understanding of the development of people across the different lifespans and a history of where we came from in our prevention efforts up until where we were now. So I'm going to stop right here for a second and ask, do we have any questions in the comments section or any questions anybody wants to ask at this time? I can't see, sorry.
It's okay, Shay, I'm here. There's nothing.
Question from, yep.
Sorry, David.
It's okay, Jen. There was a question from Mary. There's no questions in the chat, but Mary had a question.
Yeah, go ahead, Mary.
I'm wondering, in light of the new gambling that's coming on, do you see gambling being added to this list for prevention? Because it's gonna, I mean, we can consider gambling a public health problem because of, you know, do you see that working its way into these presentations?
Yes. So we actually do have a gambling series. I'm going to touch on that a little bit more towards the end of the presentation. But gambling, of course, is a mental health and a public health crisis that we also want to work on as well. So I think that once we get more into, like, I'll touch on it a little bit more later, but it is definitely a part of prevention. Yeah. Any more questions before we move ahead into the continuum of care? Yes, Beth, there will be a copy of the presentation. All right, moving on into the continuum of care. So just taking a look at this diagram for the continuum of care. There are 4 different sections of the continuum of care. There is promotion, prevention, which is kind of where we are, treatment, and recovery. They all kind of work together in order to build a healthy community, in order to keep people who are within this, the promotion and the prevention stages from having to move into the substance treatment and recovery stages. Well, the substance treatment stages, because they've already began using. So as you can see within the different scopes within prevention, there are 3 different types of prevention: universal, selective, and indicated. And we'll go on more of that as we go later into this presentation. So what is the continuum of care? So the continuum of care is how we work to prevent unhealthy behaviors, encourage promotion of healthy behaviors. So the continuum of care is basically a model of promotion of health at every stage. And it's where organizations work together in order to create a system of communal health. That way that access to education and prevention is easily accessible, health promotion is easily accessible. And if individuals move into stages where they need treatment for substance use or other mental health issues, other health issues, they have access to those communal health resources. And the reason why it is important is because it fills the gap in patient care and health. So when someone has to move or a condition worsens or even changes, transition in care is seamless. So prevention works at both the individual and environmental level to provide communities with the information and skills to support healthy choices. So our prevention messages and strategies aren't really efficient to help a person stop using once they've begun using. So therefore, when they begin to go into areas where they are going to get or need more care and resources, it's a bit seamless for them to move from one's transition from one area to the next. That way that treatment and care is is able to improve the satisfaction of life from one area to the next within the continuum of care. This also reduces health costs and it improves overall health care in general. So we incorporate prevention into the continuum of care because we use we can use our drug-free communities as well as our SPIF. They strengthen and align our systems to optimize well-being. So we can figure out where our gaps are by using our assessment within the SPIF, understanding the capacity for different resources that we currently have, and then plan for other ways in which we can provide the community with more resources should they move out of a stage of prevention into a stage of treatment or recovery. We also are able to elicit attention to social detriments of health and changing our systems so that everybody has access to resources in order to stay healthy and promote health and well-being within our community. Next stage. So prevention, as I said before, is divided into 3 subcategories. You have universal, selected, and indicated. As you can see at the bottom, universal is going to be your largest category. So universal would be the assessment of an entire population. For example, if we were to use an entire population, we could say the city of Hartford could be a universal population because we are looking at the prevention and addressing substance abuse and misuse within that entire population. If we were to use a selective preventive method, that would take a subset of that total population who are deemed as at risk for substance abuse or misuse. I'm not saying that for this example, I would use I'm not going to use, but for this example, if I was to use a selective from the city of Hartford, I can say Hispanic men under the age of 30. Now, this is a rhetorical, I haven't done the research on this to know whether this is true or not, but this is a rhetorical selective. For indicated, these are individuals within that specific selected population who are already exhibiting early signs of substance misuse or other problem behaviors associated with substance misuse. So these individuals are going to be at a higher risk. So if I was to say my demographic from the city of Hartford for Hispanic men under the age of 30, I have already encountered men who are displaying the risk factors for misuse for this selected population, and I would identify those individuals. And we'll go over what exactly our risk factors are in the next module. Do I have any questions for this module? Nope.
No questions in the chat.
We're all set. Thank you. So the next module that we're going to go into really quick is going to be our risk and protective factors. So risk and protective factors are kind of what we look for within our community when we're doing our assessment and seeing like what makes people want to use any particular substance or whatnot. So first, let's start with risk factors. Risk factors are, as I defined it within the first module, are factors that increase the probability of an unpleasant outcome. So they precede undesirable or unpleasant outcomes. And if we were to have a target population, we have we divide our population within high risk and low risk. If they are exhibiting different risk factors, we can divide our population into different risk factors that way. Now, our positive factors, sorry, are they help to build resilience. Protective, I said positive factors. Protective factors, excuse me, help to build resilience. Protective factors are characteristics that are associated with lower likelihood of negative outcomes, and they help people to deal more effectively with their stressful events, any stress that are going on with their life, and it also helps to mitigate any signs of conflict within their communities or families, or if they're having internal problems, it builds resilience within them. So some examples of risk and protective factors. Risk factors can be things such as homelessness or poverty. Protective factors may be strong and supportive social systems, or a strong parent in the household who has very good discipline skills, as well as is participating in the guidance and supervision of their child. With risk and protective factors, we also have the 40 developmental assets. Now, these assets were developed by the Search Institute, and they are the building blocks for healthy youth development. They're divided into internal and external. So I'll kind of go in a little bit more detail about that, but these are the building blocks for healthy development as they foster emotional health and well-being. So we'll check the next one. So as we look through this list, I have a list of different things that are the internal and external factors. External factors are those that are developed from beyond the individual's control. They are developed by the outside of the individual's internal psyche. So things such as their family, their school, their religious faith group, their community group are things that are considered external factors, as well as things such as the public policy and laws that govern them as they interact with their community. Internal assets are those that are developed by the individuals themselves. However, they may also be influenced from factors of their external assets, things such as positive skills and resilience, caring for other people, things that are placed on that person, which may be influenced by things such as their family. Their family value may be to be a caring person, and that has been internalized by that individual to continue to be a caring person and to have that as part of their guiding system for the things that they do in life. So some of the external assets, there are 20 of them, as well as 20 internal assets. They are divided into 4 different subcategories, such as support, empowerment, boundaries and expectations, constructive use of time. So I'm not going to go through all of them because there are quite a bit of them. Of course, there's 40. But within each one, you have support, such as your family support, empowerment, such as service to others, boundaries, being able to understand their own personal boundaries, as well as what will affect them, such as peer influence, is whether they are affected by positive or negative peer influence, and a constructive use of time, using recreational time in a positive way by having creative activities or being creative within their home or having after-school athletic programs. As well as internal assets, those are also divided into 4 different categories. Commitment to learning, positive values, social competency, and positive identity. Being able to have a commitment to bonding at school, not hating going to school, or having a positive interaction with school engagement. Positive values such as integrity and honesty, personal responsibility. Social competency is things such as having positive planning and decision-making skills, as well as being able to peacefully have conflict resolution. Lastly, they have positive identity, where they have a good sense of self-esteem and they have a sense of purpose within their life. Next, we have the 8 indicators of thriving youth. Now, the correlation between the 48 developmental assets and the 8 indicators of thriving youth is that we understand that if youth have well-developed internal and external assets, that we should see these indicators present in that young person's mental and physical and emotional development. The more assets that a young person presents, the more thriving indicators that we should be able to report. So a strategy for combating substance use within a community is to find a way to increase their assets, increase their developmental assets. So we have the 8 indicators, and they are being able to experience academic success, having leadership qualities, resisting dangerous situations and knowing how to get themselves out of situations that might be dangerous for themselves, control of impulsive behavior, and a willingness to be an assistant to other people. They value diversity and are able to maintain their personal health, whether that is being sure that they can bathe regularly, brush their teeth, maintain cleanliness around their home and their room, and an ability to overcome adversity and develop resiliency. They don't completely break down over a stressful situation. They're able to find the not necessarily the good, but they're able to work through the adversity that they have without completely crumbling under that particular pressure. And I'm going to ask really quick if we have any questions for this particular slide or this section. Awesome, thank you. Oops, sorry. So next we're going to go a little bit more in depth into some of the theories and evidence-based practices in prevention. I have a list of theories that are commonly used within the prevention field, whether we actually know it of it or not. These are guiding theories in the prevention field. I did place a reference list at the end of this presentation for use for this. They are the social learning theory, etiological factors of abuse, problem behavior theory, as well as social control theory. So we're not going to go into too much depth on those because those can be a total class on their own. But these theories do cover the developmental theory of youth and people and what things affect that development that may lead to more protective factors or more risk factors. So like I said, we're not going to really go into depth on those, but I do have resources for you guys to use and to do some research on this yourself. So what are evidence-based practices? So evidence-based practices are programs and policies and other strategies that have been evaluated to demonstrate and be effective in preventing health problems. So they are evidence-based because they are effective in producing and achieving our desired outcomes. So I kind of made a little graph. I found it at the CDC. So our effectiveness is going to be low if our evidence is either harmful or unsupported. Strength of evidence is always, you want your strength of evidence to be high, your effectiveness to be high in order to have a well-supported program. Programs that are low in effectiveness are not only harmful and not of much use to the coalition's efforts, but they can also be a great waste of time and valuable resources that the community may not have a lot of if we're working with communities that may not have a lot of resources, a lot of socioeconomical capital. So some common evidence-based strategies that we use are going to be coalition building. So a lot of you may already be in coalitions and have worked in coalitions, and that's the organization of groups of people, professionals, in order to accomplish a unified goal. What is our goal? Well, in this particular case, it could be prevention, because that's what we're learning about right now. So our goal is to prevent substance use and to lower the instances of people misusing substances. That is what our goal is, and that's what we're working towards. And we want more professionals, more individuals to get on board with that goal so that we can work through that. Youth engagement and community development. So we want to create inclusive and participatory systems so that the community itself can participate and get to the goal with us, as well as themselves. In case we have sustainability program in our program, the community is able to be sufficient and help themselves as far as this. So we have youth engagement as well, and we want to have a positive youth engagement and perspective to have an effective prevention program. Youth look to their peers for what is socially acceptable. So we want to have the formation of youth councils and youth advocacy programs. As we move forward, we have social action and marketing. So social norms campaigns, we want to empower the population and spread awareness and promotion of health about the issue that our coalition has formed. We want to be able to get our message out there and change basically, not to use Demas words and stuff, but change the script about what is the norm going forward in different policies going forward. And as we move into different policies, we want to engage our policymakers in improving community conditions, whether that is by creating things such as smoke-free restaurants or mandating marijuana community ordinance restrictions. We want to be able to implement dynamic changes in our policy. Law enforcement enforce what social host law is, and also enforce the laws that have been put in place by our policymakers and show that there are consequences and increase the perception of risk. So this is just basically a short list of common evidence-based strategies that we might use when we are going forward in our prevention efforts. So some of the core elements of our effective evidence-based programs are going to be the structure, the content, and the delivery. We don't want to be too broad, but also we don't want to be too narrow as far as what we use for our program when we build out our program. So we want to ask ourselves, how is our program going to be organized? And what is going to be the structure? What is the content, the information that we want to have presented? And how do we plan on getting our program out there, implemented, and then evaluate our target population? So as far as structure, we're going to kind of go through each of these structure, content, and delivery to kind of touch on those a little bit. So some of the things that we use to present our different content and information. It's important to know what our audience is and what our target population is. Is social media the best way to get your message out there? Are you using, your population younger people who primarily look at things such as Instagram, YouTube, TikTok, Twitter, things of that nature? How are you going to get that message out there? Do you have people who are able to present that kind of information, who know how to use these different platforms and get the most effective information out there? Do you have customizable content? Things such as Canva have different abilities to present your information by making your own customizable content, whether that be by using your coalition's logo and getting that out there, presenting customizable things that you can present on your different platforms, as well as different ways of delivering your information. Are you using traditional media, such as different ways of pushing out your media through things such as billboards or newsletters? Are you using television ads in order to get your information out there? So drug information alone has not been found to be effective in deterring drug abuse. So we have to combine information with skills, methods, and services that produce more effective methods. Methods are going to be geared towards change, such as establishing and enforcing rules on drug abuse in the schools and at home and within our communities. So we have to understand who and what our community is and how they will need to access all of our messages. Next, we're going to move forward into delivery. So how will you adapt and implement your program? In Adaption, we are shaping our program to fit the specific need of our population. We understand what our population is and what makes them unique, what their current needs are, what current gaps are, and getting them the resources that are necessary. And implementation, how will we deliver the program? Are there sessions that we need to have? What methods do we plan on using? And what way are we going to evaluate the program that we have, collect data, and then proceed with follow-up information? This is just kind of a little setup of how we are going to use different core elements of evidence-based programs. If you take a look at the first table, I included within it I divided it by the different sectors of prevention, universal, selective, and indicated, as well as for each one, the structure, the delivery, and the content. That's three separate tables. So within the first table, if I was to go to community under universal, structure, I can see that my audience is going to be all youth. And the setting of my evidence-based program, I'm going to use a social norms campaign. Now, social norms campaign can be things such as billboards. They can be ads run on TV, ads run on YouTube, ads in general, your newsletters, different things that you need to use in order to get your information out into the community. For schools, since your schools are going to be a little bit more selective, you're selecting different parts of your school, you're going to select the population, and you're going to, for this particular one, we selected middle schoolers. So the setting of our program could be after school programs, since we're meeting with middle school students as our selective population. If we move further down and into indicated populations, we choose families. Now we're going to choose the audience for this particular one could be high-risk youth and their families by selecting the ones within our selected population. And we can run clinics, whether that is within an actual medical clinic, or we can do after-school clinics, just different things that target that particular selected population that we have. And that's kind of the way that the rest of these tables go as well. So I'm going to include those in the things that you guys will get today. So moving forward, we want to keep prevention going. So prevention strategy is more than just one set strategy. It's more than a one and done event. So in order to be totally effective, I wouldn't say totally, but to be more effective, you may have to use multiple strategies and then have these strategies reinforce one another over time. So if we think back to our evaluation of the SPIF, our evaluation was looking at whether the program was working, what we could sustain, and what we can improve. So in order for us to move forward with making sure that our strategies are always effective, we need to make sure that we have data-driven evidence in order to make sure that the strategies are working. We might have to tweak our strategies a little bit based on what new data comes in, or if we have different changes in our population as like sometimes populations change. Sometimes you might have a wave of different people moving into the area. So it's always important to reevaluate as time goes on, in case you have to change out your strategies, in case you have to do more different events, reach out more to the community. Do we have any questions in the chat box, or if anybody wants to come off mute to ask a question or anything?
No questions in the chat, Shay.
Awesome, thank you so much. So we are going to move ahead into drug facts. We're not going to cover like a whole wide array of drugs and substances. So we're going to focus on 4 different ones right now, which are going to be prescription, alcohol, methamphetamine, and marijuana. Prescription drugs are going to be drugs that have been prescribed a script by a physician, and they're used to treat physical or mental illnesses. So they're usually going to be there's a couple more than this, but most drugs are stimulants, depressants, and then you have opioid drugs. Misuse from prescription drugs usually occurs from using the substance outside of the physician advice, or by using another person's prescription. So when I say using it outside of the physician's advice, a physician could say that you are supposed to take this drug twice a day for a week. And outside of that physician's advice, misuse would occur if that person decided to use the drug 3 times a day for 2 weeks and continue to use it outside of the time that they were allotted to use it, as well as someone using the prescription of another person who was not originally prescribed this medication. So one of the prescription drugs that we are going to talk about is opioids, which has been in the media a lot lately due to opioid misuse epidemic that we've been seeing a lot in our country. Opioids, I want to kind of draw a distinction between opioids and opiates. So opioids are synthetically made narcotic analgesics, whereas opiates are naturally occurring from opium poppy plants. So they include the chemical naturally from the poppy plant. And those drugs usually are opium, morphine, and codeine. Opioids are usually things such as Oxycontin, hydrocodone, fentanyl, and a couple others. Heroin is also an illegal opioid. So opioids are usually used to treat pain or other associated with medical procedures such as dental procedures and medical surgeries. They're highly addictive and they can cause overdose and addiction. So a lot of times we usually see them in pills, syrups, skin patches, suppositories, and lollipops. The lollipops are usually one that you would find for fentanyl, but there are a couple others that have lollipops, which are basically small, stick-like looking medications that are taken and placed on the cheek and absorbed through the mucosal membrane on the cheek. Common names that you'll hear for these different opioids are going to be things such as Percs or Percocets, Oxycontin, Vikes, Tramies, chill pills are a couple of common names that you'll hear. Treatment options are usually going to be medication-assisted treatment in order to reduce the cravings. And this is sometimes done using a couple other medications. And if not done correctly, an individual can become actually addicted to the medication used to treat opioid addiction. As well as another treatment option is psychotherapy. So there are a couple different options for treatment at this time. One thing that is of particular note is that mixing substances with opioids can increase the risk of overdose. So common things that you might see people mix with opioids is alcohol, which is particularly dangerous as it lowers inhibition and lowers the person's perception of risk when they use this thing. And they have a higher risk of overdose and possibly dying. The next drug we want to look into is alcohol, which is in itself a depressant drug, as it lowers the user's central nervous system and causes impaired judgment, slurred speech, distorted realities. So you'll sometimes hear someone say that they had beer goggles, which is that they have a distorted view of reality, or they're seeing things that normally they wouldn't see when they were sober. So it's not a hallucination, but rather that they don't see things how they normally would. It's distorted. So someone's tolerance level of alcohol is usually dependent upon their weight. Females tend to not be able to drink as much as males, as well as whether that person has eaten or not. And depending on their tolerance and the number of drinks taken, alcohol can have initially cause the person to have feelings of euphoria. So moving forward, I wanted to go over underage drinking. So within the state of, within the larger United States, the legal drinking age is 21. However, in the year 2019, about 7 million young persons between the ages of 12 and 20 reported that they had had a drink within the last month. So youth drinking is a lot more dangerous than adult drinking, of course, because youth are not as developed mentally to begin with. Youth are also less likely to drink often. However, they're more likely to binge drink, and that is having 4 to 6 drinks at one time. So about 4.2 million people aged 12 to 20 have reported to binge drinking at least once. Also, underage drinking and binging have a significant factor in deaths and injuries of people under the age of 21. We hear a lot of reports of underage drinking and driving. So you hear a lot of reports of motor vehicle accidents or falls or alcohol poisoning. So those are the top things that we look for in underage drinking. Next, methamphetamines. So methamphetamines are, these are stimulant drugs, and they also affect the central nervous system. However, instead of feeling sluggish or slow or having a slowed down perception of reality, people who use methamphetamines are said to feel aggressively smarter or intensely focused. Methamphetamines are commonly prescribed medications for disorders such as ADHD, and they are also considered dangerous when mixed with alcohol and opioids, and you risk a higher risk of alcohol poisoning and overdose. If you look at the picture right here to the right, this is commonly what methamphetamine looks like. It may look like tiny pieces of glass or blue and white rocks. However, it can also be crushed up into a white powder or taken as a pill. Right now, treatment options for methamphetamines are commonly going to be psychotherapeutic methods. However, there are treatment medications that are currently in clinical trials that are being used to treat that are going to be used for treating methamphetamines. However, we're not there yet. Lastly, we wanted to cover marijuana. Marijuana is a hot topic in Connecticut lately because of the legalization that just happened not too long ago for use. So marijuana is a plant substance that is a psychotropic drug in the not just in the United States, across the world. And it is noted that people who use this particular drug feel euphoric, hungry, and tired. One of the things that is emerging with marijuana use is like tobacco. It can be used with the vaping device. Vaping devices are electronic devices that have heating elements on the inside of them. They rapidly heat oils and allow the user to smoke them as a vapor. It is actually an aerosol that is smoked out, and it is just as toxic as a regular smoking product. Other ways in which people use marijuana are they are sometimes used as ground up and placed into food as edibles. You may see people using them as topical creams or as resins, or burning them through pipes or through papers. Currently, the treatment options for marijuana are going to be mostly behavioral health, psychotherapeutic methods in order to treat. Next, I just kind of wanted to cover some stuff about the Connecticut marijuana facts. Recently, we had, have a couple people who may be from other states, but recently Connecticut legalized adult use marijuana, that is users of 21 or older, on July 1st of 2021, this year. This law allows people to possess 1.5 ounces of cannabis and also the cultivation of marijuana by adults. There was an expungement of nonviolent marijuana related convictions that involved less than 4 ounces of marijuana, and that will happen automatically in 2023. It's said that commercial sale is likely to begin in late 2022. However, some people are already getting prepared for their municipality to begin sales on marijuana. So one of the things that I'm going to stop sharing screen for just a second. One of the things that I'm going to include when I send information out to everybody is that the PTTC, New England PTTC, as well as the Wheeler Clinic, Wheeler Clinic Connecticut Clearinghouse has included a information fact sheet about the legalization of cannabis in the state of Connecticut. Well over the legal transcript itself had well over 100 pages, and they were able to kind of cut it down to about 4 pages. So it's a lot easier to read. If you have not been able to read it or see it, it is definitely worth the read now, because it is, I'm not sure if like anybody else is like me, but reading a lot of legal jargon is a little bit hard and a little bit frustrating at times in order to understand all of the different things. However, this document is free to use. You guys can take a look at it and see all of the different things that are going to go into effect upon the legalized sale of adult use marijuana in the state of Connecticut. And I am going to stop sharing for a second. Is there anything, any questions? Thank you, Romeo. Where can we find the doc? So Dina, I am going to send the document out to everyone. However, it is also on the New England PTTC's webpage as well. So I can also include the document, and I can also include a link to the document as well, if you guys want more information about that. No problem. Do I have any other questions? No. Okay, so I want us to kind of have a little bit of time for a discussion. So I'm going to put you guys into breakout rooms. Let me bring this back up. And I kind of want to discuss basically if you live in a municipality that is preparing for the legalization of adult use marijuana, what is your local government doing, your city government doing, or your municipal government doing for the preparation for sale, as well as have you viewed any changes in perception of the attitude of legalization of marijuana in your neighborhood, city, municipality? And if you work with a coalition, what are some ways that you guys are preparing for the sale of marijuana in your area? And are there any things that you guys have done so far as the legalization? So I'm gonna break you guys up into breakout rooms and give everybody about 15 minutes. And yeah, should be good. And go. All right. Let me see if I can broadcast that.
How you feeling so far, Jay?
I'm good.
You can just take a breath. You're doing good. Slow down. You are covering a lot of material.
Yeah.